we've had a series of meetings. We have met with all the county health directors. I think perhaps one county was not present last Friday, with Dr. Michael Mendoza and all his colleagues around the region, getting their input on things they would feel would be important for a safe opening. We met with elected officials, county leaders, IDA leaders, economic development leaders yesterday on a call. I just got off a call with Chamber of Commerce leaders around the region. And my job is simply to ask questions, listen, and be able to pass on information to the governor's team for their consideration on the reopening. We know from the governor's comments, May 15th is his date right now to look at the reopening of manufacturing and construction. He stated he would pause 2 weeks after that opening and then make other decisions afterwards based on the medical data. Everything we do is based on health and safety, and that's why the medical directors, health directors around the region play a major role. But my role is simply to gather information and provide it. I will tell you folks, I'm not publicizing what we're gathering right now, only because my job is to make sure I get that to the governor, not put things out first. Happy to talk about the process itself. Happy to answer your questions as best I can. But the meetings have been extremely informative. They've been engaging. I make some opening comments. I listen, I ask questions, I explain the role, and we're encouraged that the governor has at least identified 2 regions, Finger Lakes and Western New York, as areas that he wants specific advice on. So it is my responsibility, I feel, to work as quickly as I can, to listen, to get information back to him so we don't have any delays. I've said this before, there's no task force, there is no committee. If you don't want something done, have a committee. I just feel that at this point here, we get information to people from them and get it to the governor, and the governor's team has been great in terms of engaging them, listening, and that's pretty much all I can say, but happy to answer your questions.
Tia Collins has the first question.
Good afternoon, Bob. Thank you for talking to us today. My first question is just having these meetings, what have you learned? What has been the greatest need expressed to you?
Well, there's no secrets here at all. And the governor gets this better than anybody. People are frustrated who own businesses. They want to get reopened, but they want to be reopened safely. And there's a lot of questions how to do that and how best to do it. So we're encouraging people some steps they should take based on health data. But that's pretty much it. But, it's interesting. I saw a national poll today. Overwhelmingly, people support restrictions that have been placed. And even some think that the restrictions should be even stricter than what they are. So everyone we talk to, they understand what the governor is doing. They respect the governor's role. They've appreciated his leadership. Certainly, if they own a business, they want to get back up and running and do that. The governor wants that too. Keep in mind, every day a business is closed, there's no sales tax revenue going to the state or the county's localities. So there's a constant loss of revenue for everybody with these. But there's no secrets or really nothing outside the box. It's pretty much that they understand why health is paramount, but just are looking forward to getting to that point where we can reopen safely.
Patty Singer is next, followed by Wendy Wright.
Hi, how are you consulting with mental health professionals to guide the reopening of businesses, both from the business owner standpoint as well as the community standpoint that's really struggling with some mental health issues right now?
Well, that came up with our health directors. So part of their responsibility, things that were raised with them, was looking at the mental health impacts. We don't have a call just on for mental health professionals. That was not our role. Our role was really to try and provide the best information back to the governor. But the health directors did raise that. The health directors are looking at that. We'll be getting back in touch with them constantly. I don't know if I mentioned this before, our meetings, aside from different areas of expertise, chambers, business, health directors, elected officials, other leaders, we're going county by county. We have a 9-county region. We want to make sure every county is heard. So we schedule these group calls with leaders in every county. And I'll make sure I raise that in addition to the health directors. But I don't have any data yet on that one, but it is a consideration and certainly one that they are looking at and certainly will be advocating for.
Wendy Wright, then Sarah Taddeo.
Hi, thank you for taking the question. I wanted to ask you about furloughs at UR Med, how that could affect the economy, what you're hearing about that as far as how many. It just, in this time, seems like during a pandemic is a tricky time to be letting go of healthcare workers.
I only heard that in the news reports with URMC, but I do know with our two major hospital systems, the halt on elective surgeries and treatments during this time has caused huge financial hardships for both systems. I can't quantify the dollars. I don't want to say my guesstimate publicly, but it's an exorbitant amount of money they have lost. So they really reflect the overall economic pain everybody is feeling. I know Mayor Warren mentioned in news recently, she is planning on layoffs and furloughs. Other companies have already had a number of layoffs. I'm proud to say the Chamber of Commerce, we have not laid anybody off here. We've just under 50 employees. We're hanging in trying to ride this out, but we've also suffered revenue hits. So I get that, and I have faith in URMC and Rochester Regional, especially those health systems. Any decision that either one of those make are going to be prudent. They're not going to impact public health at all, but it is also it's just a sad state of the economic realities that we're facing. We had a video conference yesterday with our comptroller, the Honorable Thomas DiNapoli. He is the CFO for the state. He talked about the budget projections, which really mirrors what the governor and our budget director, Rob Mojica, have talked about. But they're talking about budget holes projections right now being north of $13 billion with a B. And that just grows by every day, week, and month in this situation. So we're all in uncharted waters. We're all in an area that we're not sure what we can do. And it really echoes the pain that business owners are having, whether you're a small mom and pop business or a major corporation or a bank. Everybody is feeling this pain. So I wouldn't pass judgment on that. I think they're doing what's prudent. And it sounded like they're taking some pretty common sense steps to try and get through these very, very tough and uncharted economic times.
Sarah Taddeo, then Randy Gortman.
I just want to
Hi,
clarify
Mr.
that.
Duffy. Oh, yep, go ahead. Go ahead, Wendy.
Wendy's on mute. Go ahead, Sarah. We can get back to Wendy.
Okay. Yes, I'm asking about malls in the Finger Lakes area. We're doing a statewide story on that, and I'm wondering if you can tell us anything you know or anything you're able to share about what the reopening might look like for them.
There's nothing to share on that at all. There's no decisions made, but I can tell you that the governor has a great team around him, and he's asking for information from all of us. These statewide and national associations for malls and retail outlets are everybody is working on plans to reopen. So I think those suggestions coming up will certainly have an impact. There has been no decision. I've been involved in no discussions on that, but I'm sure behind the scenes, if I were to offer suggestions to any business, any enterprise who maybe is deemed non-essential and is not working right now, I would work on having a plan in place when that decision date comes, be it 2 weeks, 4 weeks, 6 weeks. I can't speak to that. But areas that we constantly talk about are our face masks, our hand hygiene, disinfecting, and social distancing. And I've actually walked into businesses here. I won't mention who they all are, but I've been with leaders who are preparing for that, who really are going through some very thoughtful changes in their respective businesses if that day comes to reopen. So my sense is always be proactive. Don't wait. Don't wait for somebody to say, we're going to reopen. If you have a plan, then you're delayed by 2 or 3 or 4 weeks. I'd be working on that right now. And paramount has to be the safety of employees and safety of customers and how you do that. And it varies from high density businesses down to very small mom and pop shops that may have no more than 1 or 2 customers at a time in a shop. So I think those things vary. And one of the things I've heard too from businesses is making sure that those that don't have the economic strength to purchase some of the equipment needed. We've been very fortunate that our chamber has given out, I think, up to 10,000 masks for free already. And we've given some to media outlets, businesses. It's come from 2 philanthropists. One is our board member, one has gone anonymous. And we will always ask for help from those that certainly can provide that kind of assistance to help those that don't have masks. I have a package, actually 2 packs in my car. I have been out, one truck driver gave 3 masks to, saw him at a situation and asked me if he had masks, didn't have, gave it to him. I just thought I have them to hand out if I need be on a piecemeal basis. I'm not around very much because I'm like you. I'm in the office today alone with like one person, the whole building with me, but I'm usually home. I'm trying to abide by the same rules, but I just go back to my point, prepare for the future when that comes. The governor's not committing. He's looking at the health data, but I would not wait. I would have my plan in place and be prepared for when that day comes.
We have several lined up. We'll go with Randy Gorman next.
All right. How are you, Bob?
Randy, how are you?
Good. Just a quick question. Although this is a couple of days ago, you probably heard about the pizza stop guy was frustrated, was looking at reopening and kind of got slapped down a bit by the town, and health officials decided not to. Are you seeing much of that kind of frustration from especially the small businesses that are on the edge and saying, hey, I just can't wait any longer. I'm going to find a way to make this work, maybe even if it's not within the letter of the law?
Randy, we're hearing it. The example you gave, somebody asked me over the weekend, it was not my role to weigh in, but that business was visited by a local official, and really the ramifications are probably as or more serious than the current losses. I just got off a call, and one of our chamber colleagues mentioned the same thing of some businesses in his jurisdiction having frustration. That's not the way to go. I understand the frustration. That's why when I was asked by the governor to take this role, this is not like a 3-month process where we're going to go out and have meetings and just have a big committee and gather things and have subcommittees. This is all hands on deck, as much information as soon as we can to the governor's people so they can make a decision on their timetable as quickly as they can. That frustration is there. We get it. We understand it. There are a lot of businesses that are open and really abiding by curbside service, things like that, that is not perfect, but they're making a go of it. Restaurants, I was at one over the weekend that I thought was great. You'd call ahead, you give a credit card, you pull up, they come out with masks on, they put it in your car, you drive off. So I think people are adapting, but I just would say for people that have that frustration, I just please hang on, because if someone were to call and report, and there are people that are reporting businesses that are open, there are employees, there are neighbors who call, they call Department of Labor, they call the towns and villages and cities. It just is not worth the ramifications. We don't want people to suffer anymore or suffer from that kind of enforcement. And the pizza stop example was a good one. He relented. He can deliver. He still can deliver and pick up. So he's not shut down, but the dining room issue for restaurants is something that everybody gets, and that has not been resolved yet. The governor's not made any announcement as to what his plans are, but we are gathering information here from every area you can imagine and trying to get that to his team for their consideration.
Got about 10 minutes left, several more to get through. Forgive the pronunciation on this one. P. Musinak is the next question.
Yeah, it's Patrick from News 10. Bob, if businesses were to start open, what about schools and childcare? Don't they have to kind of simultaneously open at the same time for parents who depend on them?
It's a great question. I probably get 20 emails a day at least on schools. I have no idea about the schools. I'm not a decision maker. I don't know where that's going to go. There are strong feelings on both sides. The governor has talked about businesses opening without schools and parents who are working and don't have childcare. Those are issues. He has not made a decision, obviously, on that. The county executive was on a call yesterday who said the county has huge capacity right now, our Monroe County, for childcare. So the availability is there. One of the things that I am suggesting to people is that whatever the governor decides in terms of reopening strategy, I think every company should look at continuing as best they can the remote working. If you can work remotely, great. For a lot of companies, you can't. You can't manufacture, you can't package remotely from your home, but there are functions in every company that can. So even as businesses reopen, I think we reduce the infection rate, we reduce the proximity that we have with people and the concerns they have by keeping these remote workplaces going. At our chamber, I mentioned, we have just under 50 employees. I have no intention of bringing back this entire team at any point. in the foreseeable future. As we begin to reopen in the future, we may be 10, 20% on site, the rest remotely. Every one of our employees have done a phenomenal job working in this capacity, and they all have concerns. They have children, parents, families. So the remote aspect of this, the reopening phase, I do think it also played a major role in not overwhelming people with issues of childcare costs, which we all get are exorbitant and take a huge chunk out of people's incomes.
About 5 minutes left. We have 2 more questions. We'll start with Andrew Banis, followed by Jeremy Moole. Andrew.
Hey, Bob. I wanted to ask about, we know construction and manufacturing are sort of the phase 1 industries that you're considering and that you're looking at right now. Are there any other industries in phase 1, or is everything at that point more of a phase 2 business by business thing? And what might some of those industries be then?
I wouldn't guess, Andrew. I've listened to the governor on several occasions. He has mentioned construction and manufacturing being the first ones on May 15th. And he talked about a pause for 2 weeks. So he will make that decision, he alone, make that decision. I wouldn't guess. I will provide information to his team and the governor and give my best thoughts on what we hear. But the decision making is solely with the governor going forward. He'll make that decision. And I've worked with the governor. The governor is both a friend and a colleague. I'll guarantee you he is relying on the data. He does not want to make any decisions that will drive up the infection rate. Even yesterday, we have 300 plus people who lost their lives in New York State. It's way below where it was last week, the week before. It's still way too high. We're over 100 deaths in Monroe County, and kudos to County Executive Bello and Dr. Mendoza keeping us really up to date with their data. It's tragic, and some of the things that we're hearing every day, we can't open too soon. And I was struck with stories of even people in other states who are protesting the closures have now come down with the coronavirus. It defies logic. I think people that are frustrated, we get it, but this virus knows no boundaries, and it's taken just really an unbelievable number of lives, and a number of people who are still in this community are on ventilators, and we're not sure what the outcome will be. So these measures are in place for a reason, and knowing the governor as I do, he does not bow to pressure. He's going to go with data, and believe me, every day things are closed, the state is losing revenue. He does not want to stay closed. It's not an economic situation it's good for anybody, but he does not want to lose more lives. That's the best I can answer on that one.
And we'll wrap it up with Jeremy.
Thanks.
Jeremy, are you still with us?
Yep. Sorry, I had to find my unmute button. Bob, I was just wondering, have you been talking to any employees at all throughout this process, asking what they think or what they need to feel safe as they go back to work?
Jeremy, with a calculator, I could not count the emails and calls that I've had in the last week. Owners and employees, I hear a lot from employees. I hear a lot of concerns they have about safety, of being asked to go back too soon. They are concerned. Nobody wants to go back without the proper equipment, and having PPE and distancing and disinfectant. So they are concerns. And I'll say from a business standpoint, some of the uncharted waters are people are having this debate now about liability on behalf of having people come back too soon, having them get infected. There's no answers to that, but there's a lot of issues, I think, for both businesses and employees. Both sides have concerns. No business wants to bring people back, cause the infection rate to go up, lose somebody or a family member of one of their businesses. So we've heard this loud and clear from people. So I think there's really passion on both sides. And Jeremy, to go back to your point, while people are frustrated not being able to have their businesses open, if that's the case, they understand. They understand, they get it, but nobody wants to end up risking another life. So we're hearing both sides, and both sides are pretty much aligned. There's not a disparate view on this. They're pretty much aligned on this, and that's why the decisions to reopen are very complex. They're not easy, and I applaud the governor. I mean, the governor has done this by the numbers. He has been a national leader in doing this, and you cannot be a leader in this situation and not be criticized. You cannot be a leader in this situation and not see frustration. but he's not there to be liked and be popular. He's there to make the right decisions. And everything I've seen so far, he's making the right decisions. We try and clear up any concerns about logically why one is open, why one is not. He is not down in the weeds on all these decisions. That's why the people on the ground and his employees are so important to bring that back up. And I see my role as getting the best information I can to him, unfettered, as quickly as I can, allow him to consider that in his decisions. Not get out front, not make recommendations publicly, just get it to him. And I think that's the way this process should work.
I did promise Wendy one final follow-up in the last 2 minutes that we have. Wendy.
So nice. I was just clarifying that $13 billion. That was a statewide number from the comptroller, correct?
Yeah, that was his projection, going forward with a budget. And Wendy, I would say this, it could be a little bit less, it could be more. We don't know. And every day this goes on, there are costs. There are a lack of revenues coming in. So, and it's going to affect everybody. And the comment made by a national elected leader about let states go bankrupt defies all common sense, because if a state in New York won't do it, it will not happen. But if a state does go bankrupt, hospitals, schools, everybody's affected by that. We don't want that, but there's going to be a huge budget gap. I don't think anybody can expect bailouts, extra money coming in. It is not going to happen. I know even locally we have entities that look for that bailout every year. I would not wait for or hope for anything, because the state just does not have the money. They don't want to have to borrow, which really complicates other finances for them. But the budget holes are just huge. And Mayor Warren, I understand the mayor's position. She made a comment. She has not made decisions yet, but the mayor is articulating the pain everybody's going to feel on this. And she is correct to look at what decisions does she have to make. And that's indicative of what everybody across the state will make. You know, it's not about protesting cuts. People have to make cuts. I'm on a call today. I'm a trustee at SUNY. I'm on with the SUNY board. Community colleges, announcements came out about community colleges. Everybody is facing this, but we have to adapt. Maybe I'll close by saying this. This is a great lesson for all of us. Governor said this, and I agree. It's not about coming back the same. We should reimagine the future. It's time to look at how do we do business differently, perhaps saving money. I think this whole issue of remote learning for our kids, we weren't really prepared for that. That could be a huge way for the future, but we have to kind of reimagine how we operate. This pandemic should be a learning opportunity, a laboratory for us to look at our mirrors, all of us. I'll speak right for our organization. We have this discussion twice a week with our management meeting we do remotely. What do we need to do differently as we emerge from this to better serve our members, better serve this community? We all have to look that way. Business as usual is not going to be the order of the day going forward. We're all in this. We're all going to feel the pain. But the more we collaborate and come together and not point fingers or think we'll get a bailout, the more successful we'll be going forward.
All right. Thank you, Bob. And thanks everyone for joining us today.
Guys, thanks to everybody. Thank you. Stay healthy.